Manual, Shared Decision-Making for Breast Surgery. We hope to introduce the surgical process and help you to find the most suitable therapy for you by the following video. Introduction of breast tumor and calcification. 90% of breast tumors are benign and only 10% are malignant. Fibrocystic breast, benign lumps usually in 30 years old women. Fibroadenoma, benign tumor commonly in 20 to 25-year-old women. Breast calcification, calcification due to cell necrosis. Breast self-examination can achieve early identification and treatment of disease. Checklist includes breast mass, painful swelling, nipple discharge, abnormal mammography, or calcification. Please consult a doctor if you have any above condition, or examination process of breast disease. First, self-examination. Second, physical examination by a doctor. Third, breast sonography or mammography. Finally, fine needle aspiration or biopsy. You will receive further treatment or follow-up according to medical report. Minimally invasive, anchor, and conventional surgery are two available surgical treatments. The advantages of minimally invasive surgery include tiny skin wound, about 0.5 centimeters, no suture, shorter operation time about 20 to 30 minutes, less impact to post-operative activity and normal cosmetic appearance. 6. Treatment of breast calcification. Calcification may result from inflammation, scars, or cancer. It is a phenomenon, not a specific disease. Calcification can be removed after mammography and fine needle localization. 7. Medical image analysis. 90% of the global breast calcification is benign. 10% is malignant. We listed 5 considerations to help you to make best decisions for the treatment of breast diseases. Please check the following items. 1 point is very not important, 5 points is very important to you. Accept economic consideration and surgical complications. The higher the other 3 scores means the more suitable surgery to you. In addition to conventional surgery, there is a newer minimally invasive surgery. If you want a shorter recovery period, faster wound healing and less pain at the expense of higher cost, the new surgical technique approach is highly suggested. 7 advantages and disadvantages of general anesthesia. Advantage: pain-free during the process. Disadvantages: may be dizziness, oral injury, sore throat, and dental injuries due to airway management. Be cautious for inadequate fasting hour and poor dental condition. Before making a decision, you can also think about the following questions. Please consider whether you have understood the benefits and risks of anesthesia methods. If you still have doubts about the treatment, we are willing to offer you with more information and explain again. When you decide to receive breast surgery, the following preoperative preparation will provide you important information. 1. Did you get complete information before surgery? Healthcare providers will always provide you with relevant assistance. 2. Is the surgical consent completed? 3. You will undergo preoperative evaluation, anesthesia counseling, to understand the anesthesia technique. 4. We will provide you with the relevant precautions about surgery. There are several important preparations must be done before surgery. 1. Fasting from midnight before surgery, including water, cigarettes, and betel nut. Preoperative fasting at least 8 hours may reduce the risk of intraoperative aspiration pneumonia. 2. All movable denture, metal ornaments, contact lenses, underwear, makeup, nail polish, and crystal nails must be removed at the day of surgery. 3. Before entering the operating room, please pee yourself. Put on the surgical clothing and paper cap. You shall be accompanied by an adult family member. Teen Intraoperative Preparation 1. Pay attention to the way of surgical clothing. When you enter the operating room, we will check your identity and help you to move to the operating table. Teen Intraoperative Preparation 2. Before the anesthesia begins, we will check your identity again and surgical information. General anesthesia was induced by anesthetics injection, then you will be unconscious and receive intubation. Intraoperative Preparation 3. In order to keep your safety, we will restrain your hands before anesthesia. You will be transferred to the recovery room after surgery. Operative wound care and dressing. The instructions of strip surgical skin closure, at a 45-degree angle. Draw skin closure device closed using clear pulling tabs in opposite directions. Approximate and align all wound edges. Apply clear adhesive pad to skin 1-2 mm from wound edge. Continue surgical skin closure for 3 to 6 months. It can improve wound looking and reduces scar formation. Surgical wound care. The wound will be covered by gauze and elastic bandage. If you feel too tight to feel discomfort, we will recover again. Keep wound from water for 3 days. You shall have bruises at surgical site, but there is no need to heat or massage. Avoid weight bearing at surgical site or strenuous exercise. You can take painkiller to relieve wound pain. Stitches removal is not necessary. Change dressing once per 3 to 5 days is adequate. Postoperative health education. Regular OPD follow-up and mammography or sonography follow-up. First, exercise regularly. Second, intake high-calorie, high-fat foods. Third, intake seasoned fiber-rich vegetables and fruits. Fourth, avoid irritating foods such as tea, coffee, cola, barbecue, and greasy food. Fifth, smoking and drinking is prohibited. Sixth, regular lifestyle. Do not stay up late. Please return to outpatient department follow-up a week after surgery. If following situation occurs, consult a doctor immediately. 1. Wound becomes painful swelling with heat or fever up to 38 degrees Celsius. 2. Sudden painless wound swelling. The following quiz let us remind you of the important message. 2. It is believed that you have a preliminary understanding of breast surgery after watching this video. We hope that you can make best decision by provided information. Please check the following items and thank you for valuable advice.